This is the third video in a series of 3 about managing GP workload, when to say yes, when to say no and why. And this third part covers dental problems, gender dysphoria, requests from schools and nurseries, locally enhanced services and fees in private work. My name's Paula Wright, I'm a GP and you can contact me on my NHSnet email. The report Making Time in General Practice showed that 27% of GP appointments are avoidable, and you can see the breakdown here as to the reasons why. If you watched the first video of this series of 3, you'll remember that we went through a big range of requests that GPs receive and the reasons why it might be appropriate to say no. In the first video from my series of 3, I went through some of the reasons why it may be sometimes appropriate to say no to carrying out certain tasks, and I also referenced various national guidance documents which are illustrated here. Gender dysphoria is a contentious area in the subject of the interface between primary and specialist treatment, and the next 2 slides cover a couple of perspectives. The GMC advice is that GPs should only consider a bridging prescription when the patient meets all the following criteria. They're already self-prescribing with hormones obtained from an unregulated source over the internet or otherwise on the black market. The prescription is intended to mitigate the risk of self-harm or of suicide, and the doctor has sought advice of a gender specialist and prescribes the lowest acceptable dose in the circumstances. Doctors must recognise and work within the limits of their competence, but this principle cannot be a bar to doctors taking on new responsibilities or treating unfamiliar conditions. The GPC has challenged this position and provided the following view on bridging prescriptions: that initiating hormonal treatment should be done by a specialist as part of a comprehensive assessment program. Prescribers take individual, ethical, clinical and legal responsibility for their actions and are not obliged to prescribe bridging prescriptions. Patients should not have to resort to self-medicating due to a failure to commission a timely specialist service, and this problem must be solved by NHS England making proper commissioning arrangements rather than by GP prescribing before initial assessment and diagnosis. And as with all specialist shared prescribing, GPs can voluntarily prescribe under these arrangements if they feel they have requisite competence and skills, and which we believe should be under a formally, locally commissioned arrangement. Practices are not obliged to participate in shared care arrangements. Shared care arrangements require additional competencies and additional GP nurse and administration time. Here are some key points about dental problems presenting to general practice. GPs should not attempt to manage a condition requiring dental skills unless they have the appropriate training and expertise, and both the civil courts and the GMC require doctors to have appropriate skills for any treatment they offer. They should ascertain that the condition requires only dental treatment. Patients presenting with signs of spreading infection or systemic involvement should be referred immediately to secondary care for appropriate surgical management. Clinical guidelines recommend that first-line treatment for acute dental conditions should be an operative intervention, such as extraction or root canal treatment. Early diagnosis and referral to a dentist is advised. So here's a recap of how this might be dealt with. When a dental patient presents, you need to be sure about whether it's a spreading infection or systemic involvement, suggested by, for example, diffuse or severe facial swelling, trismus, dysphagia, fever or malaise. And if this is the case, they need to be referred urgently to hospital. If it's not, then you need to establish whether it's purely a dental problem, because if there are other problems to attend to, obviously a GP has a responsibility to attend to those as well. If it's purely a dental problem, they need to be referred to their own dentist. However, sometimes patients are unregistered or unable to contact their own dentist, in which case the GP advises the patient to refer to 111, NHS 24 in Scotland, NHS Direct or local dental helplines for Wales or the Health and Social Care Board in Northern Ireland. If they are able to contact their own dentist, then they need to see their own dentist or their own out-of-hours dental service. This is another area that is fairly contentious, and that's the requests that come through to GPs asking them to prescribe over-the-counter medicines for children who attend schools and nurseries, and this has been dealt with in the revised Early Years Foundation Stage Statutory Framework. Further guidance is available on the BMA website. If you're asked to do something that you think may not be covered in the core contractual requirements, why not check the list of locally commissioned services which practices may be able to seek funding for, as this list is available on the BMA website in the Quality First section. The BMA website has useful guidance on work which is considered private work for which you can charge a fee. The BMA website also has a list of certificates that GPs cannot charge for, and this information is summarised here, but again, please refer to the BMA website for more information about this. This is just a recap of the excellent national guidance documents that are available if you have some of these common queries that we've discussed. The Quality First page of the BMA website is an excellent starting point to look for any information that you need relating to workload. This presentation on workload wouldn't be complete without signposting to GP Forward View, which covers a range of innovations intended to reduce workload in general practice. If you're interested in reading more widely about workload pressures in general practice, here are some important reports from recent years. Thank you for watching this video till the end. Do please share it and send me your feedback. You can follow me on Twitter, and you can access my other videos on my YouTube channel.